Hey everyone, I'm Ashley Schrader with Bryan Health, and I'm here today at the new Bryan Urgent Care in Southeast Lincoln Family Medicine and Internal Medicine building on 84th and Pioneers. So basically, we're really excited today to get a sneak peek because this building opens tomorrow to the community to care for patients. So very excited. We get a look behind. Not everybody gets to see everything, so we're excited to do that today. So I'm here in the lobby, and this is actually where you would come for both urgent care and for your doctor's appointment. So it's just a beautiful facility. As you can see, we've got high ceilings, lots of natural light, and plenty of space. So when you arrive, we'll actually ask that you wait in your car, and then you'll call us. We'll ask you a few screening questions, and then somebody from our office will come out to the car to bring you in for your doctor's appointment or urgent care. So just a great facility. First, we're going to head into urgent care where we're going to catch up with Jennifer Price, a physician assistant. All right. Hey, Jennifer, how are you doing today?
Hi, good morning. Good to see you. Welcome, everyone. Good morning.
So tell us a little bit about yourself.
I am a certified physician assistant. I've been in clinical practice for 4 years and now have joined the Bryan Physician Network. I have a special emphasis in orthopedics, and I'm one of several caring and competent providers here at this new convenient location.
So, and this is really exciting. So we didn't mention that this is actually the third Bryan Urgent Care location in Lincoln. So we have one at 27th and Pioneers, 27th and Pine Lake, 27th and Fletcher, and now this new location at 84th and Pioneers. So let's head on back here. We're gonna go to see a patient room. So Jennifer, tell us a little bit about some of the illnesses or injuries that you treat here at Urgent Care.
Sure. Well, we're really here for most of life's unplanned illnesses and injuries. If you injure yourself while working on a project, or if your child falls in the playground, or if you just wake up feeling under the weather and need to be seen quickly, we are here for you. We can care for a wide range of conditions, including sprains and strains, coughs and colds, rashes or animal bites, earaches or pink eye, and more.
Awesome. So I know we're also kind of passing by the lab here. So you have on-site lab services,
Correct.
Is that correct?
Yeah, that's very convenient for our patients to get the testing that they need quickly.
Sure.
Usually your results for most things are available by the time your appointment is complete, so we can make decisions here in the office. And if there is anything unusual or special that you need performed, we can go ahead and draw the lab here, and most times send it to the hospital, where
Awesome.
we work very closely with them to make sure that you save yourself a trip and get on with your day.
Perfect. So we're here at a procedure room. Tell us a little bit about the procedures that you can handle here at Urgent Care.
Sure, we can perform many small procedures, including stitches, splints, pelvic exams, eye exams, remove a foreign body, and more.
Okay. And you also do broken bones, right? I
Yes.
know we're kind of heading into the x-ray room right now. So you can do casts and things like that, correct?
Yep, so this is our x-ray room here. And we always have a radiology technician on site so that at any time of day we can get you an x-ray, and then your provider, like myself, will perform the initial analysis of that x-ray to give you a diagnosis. But then all x-rays are also overread by a hospital radiologist, so that again, by the time you leave for your appointment, most of the time you will have a clear diagnosis and plan.
Perfect. So I know I've kind of wondered about this, and probably our audience has too. So how do I know if something happens that I should go to urgent care
Yes.
or should I go to the emergency room?
Yes. Well, if there's certain things, like you have a concern that you might be having a heart attack
Okay.
or a stroke, signs that would be chest pain or a sudden change in your speech or facial drooping or arm weakness. Those are things we don't want you to waste any time. We just want you to go ahead and go to the ER immediately. But for other things, well, and another example would be multiple trauma. If you have
Sure.
an open fracture where the bone's actually showing, uncontrolled bleeding, or you have a head injury that might require further imaging, like a CT scan or an MRI that we just don't have here. Or if you have something that might turn surgical, like appendicitis or things like that. When in doubt, though, you can always call us and we'll help to kind of triage that issue on an individual basis over the phone. to help you make the best decision for you.
Perfect. And urgent care is open 8 a.m. to 8 p.m., right?
Correct. Yep.
Do I need an appointment?
And it's every day, no appointments.
Awesome. Perfect. Well, thank you so much, Jennifer, for joining us today. We
Yes,
really
thank you.
appreciate your time and for giving us a sneak peek around.
Yeah, it's good to have you all here virtually while you're feeling well.
Absolutely.
But when you're not healthy, we'll be happy to see you in person.
Perfect. Thank you so much. So, you guys, if you're just joining us, I'm here at the new Bryan Urgent Care and Southeast Lincoln Family Medicine in internal medicine at 84th and Pioneers. So, we do invite you to like our video, share it, and also if you have any questions, feel free to post them in the comments below. So now I'm standing in the Southeast Lincoln Family Medicine and Internal Medicine side of the building. So we're going to catch up with Dr. Rubab Husain, who's one of the providers with the practice. Hey, Dr. Husain, how are you doing today?
I'm good, thank you. How are you?
I'm great. Tell us a little bit about yourself and how long you've been here with the practice.
Sure. First of all, welcome to our new clinic.
Thank you.
I've been with Bryan Health now about 14 years.
Wow.
Dr. Heyman and I were the two originals who started Southeast Lincoln Family Medicine at our old building.
Okay.
And now we have slowly grown, and we're up to about 7 providers, and soon to add 1 more provider to our practice in October.
And
So
that's
it's
why you had to
exciting.
build this new
Absolutely,
building, right? For all
absolutely,
these new
yeah,
providers.
It's great. So I'll take you around a little bit. Just wanted to give you a little insight to our lab. I
Okay.
know Urgent Care has
Yep.
one, and we have a full spectrum lab as well.
Awesome.
Yeah. So things are ramping up here. We're soon to start to see our patients tomorrow.
Yes.
We've kind of created a medical home in our facility. That's what we've tried to do. So we've added a few extra services.
Okay.
One of the really nice services is behavioral health.
Sure.
And the nice thing about that is if we have anybody with acute mental illness and we
Mm-hmm.
need to have them seen right away, we would have somebody kind of right in this room. We're partnering with Bryan Behavioral Health,
Okay.
and so the provider will be here a few times a week to help us out.
That's awesome. So a patient could come to their appointment and then also meet with the counselor just at the same
Yes.
time, so they don't have to make 2 different appointments on 2 different days,
Yep.
just one
Kind of
place.
all under one roof, even if it meant just saying hello to the provider,
Sure.
to just get an introduction. I think that's really helpful in those situations. The other nice thing we've added is a care coordinator.
Okay.
And that also helps us create that medical home, which is what we're striving for. This is kind of where our care coordinator will be.
And tell us a little bit about kind of what they do.
Sure. What they actually will help us do is coordinate care. In other words, they're going to be able to talk to patients about diabetes and hypertension and heart failure and chronic diseases and help the patient manage their disease, whether it's through diet and exercise, helping us with medications. Another nice thing that we're also going to be adding is we'll have a pharmacist on site.
Awesome.
The pharmacist will help us with medications.
Sure.
Anything that we need in terms of side effects. What can the patient expect?
Yep.
So all of those are going to create this really nice one service area.
Yeah.
Yeah.
So let's talk a little bit about, I know we're going to head down and see a procedure room. What are some of the procedures that you can do here in the office?
Sure. Most of us we do full spectrum family practice procedures. So there's a lot of gynecological procedures for women's health. We do skin procedures here. I'm going to start adding some medical Botox for migraines and hyperhidrosis or excessive sweating.
Okay.
That's going to be exciting. I also kind of dabble a little bit in aesthetics, so we'll be able to provide that. Our new skin line that we're going to launch here is called the Zeo, which is Biobaji, so hopefully we'll get a whole bunch of things going.
Yeah, lots of exciting
A lot of fun
things.
stuff, yes, absolutely.
So, and I know we're going to kind of go into, we have a question? Oh, no, we're going to head right back into patient room now.
Yes.
So tell me a little bit, I know you have family practice providers and also internal medicine. So what's really the difference between those specialties and how they care for patients?
Sure. So family practice and kind of deals with pediatrics. We see patients from time of birth all the way through into adulthood, and we also do a little bit of geriatric medicine. Many of us family practice physicians here do a lot of women's health.
Okay.
I still deliver babies. Our internal medicine colleagues see mostly older adults. adult populations, elderly populations, and deal with chronic diseases. But there's a lot of overlap, and we help each other out, so it's perfect.
Yeah, that's great. I mean, it really does seem like there's so many services just right here under the same roof. I mean, you
Yes.
have care for people of all ages,
Yep.
Counseling services, care navigator for that extra support, even specialty procedures, joint injections, Botox for migraines, things like that. And then also even urgent care. So
Absolutely.
how great is that? Just one
I
location.
think it's going to be wonderful.
Yeah,
We're very excited to get this going.
absolutely. Tomorrow's the big day.
Indeed it is.
So again, well, thank you guys for watching. If you would like more information, you can actually just go to the Bryan Health website. You can view provider videos, you can request an appointment, or feel free to give us a call if you have any questions. And a special thanks to Dr. Husain and Jennifer Price for joining us today.
Thank you so much for coming out.
Yeah, absolutely. Give us a like, let us know you're watching. If you have any questions, post them below, and you guys have a great day. Thanks for watching.